That's a very dangerous myth that a person has to want it to get better. When people are using drugs and drinking, they're impaired. They're not thinking straight. So if you're not thinking straight, how can you wake up and make a good decision about your health care and your life? So that's one of the other reasons why I love interventions, is because we help get someone into treatment where their brain can begin to clear, and then a few weeks in, they can make a decision about what they want to do for their health for the rest of their life.
Welcome to Kafa Podcast. Today my guest is Heather Hayes. She's a world-renowned interventionist, which I had the pleasure to work with her on a case, also a public speaker. And besides that, she's a family therapist, she's a licensed regular therapist, as well as a hostage negotiator. So that's very interesting. Welcome, Heather.
Thank you, Esra, for having me today. I appreciate it.
Every month, I'm trying to invite a guest and speak with them about addiction and everything around addiction. People who know me, they know I'm sober, and I have this obligation. I feel like I have to shine light on a subject matter that is not very well understood in my country, and people have so many questions around that. And you're the perfect person that can help us to understand so many parts of it. The family part, the resistance part, the choosing the right rehab part, how to deal with the client part, like so many parts. So thank you for joining us. And I would like my audience to get to know you a little bit, because I know that you have a mission as well to be able to break the stigma like me. You also have no problem to share a little bit of your story and your background.
Absolutely. Thank you. I really do appreciate your speaking out, because the only way we can break the stigma is to stand up and say, this is what addiction looks like. Because I think people have got such a stereotype of what addiction is. And addiction looks like me. It looks like you. This is just addiction or substance use disorder in recovery. So my story was really that of an addicted adolescent and young adult. I started using when I was about 12 or 13. And by the time I was 16, I think I could have easily been diagnosed as having, full-blown substance use disorder. I went off to university, and I thought maybe if I changed my major to psychology that I would be able to stop drinking and doing so many drugs. And I can't say that it worked right away, but eventually, a couple of years later, my third year of college, I was able to kind of wake up and had sort of a spiritual awakening and ask for help. So I went into treatment. It was 1982, and I was the youngest person there. I was 21 years old, and I went into a program. There were very few programs back then that was specifically for addicted physicians. So I wasn't a physician. I wasn't a grown-up. I was a young adult. But I think what happened was that as soon as my brain chemistry started to clear up, and fortunately I was in a place where I began to learn that I had a disease, that I wasn't bad or mentally ill, I was able to kind of really, the lights went on. It was a big relief for me. When you're a psychology major and you're doing drugs and alcohol and you're out of control and paranoid, it's really easy to start trying to diagnose yourself with everything. So I, was very relieved when I got to treatment and they said, oh yes, you have substance use disorder. You're going to get better. You just have to quit using and learn different ways to cope and live your life. So at that point, I really, more than anything I'd ever known in my life, knew that I wanted to be a therapist and that I wanted to help other people, particularly at that time, adolescents and young adults, because I didn't want people to have to go through and suffer like I did. In hindsight, I could see there were so many times when I easily could have been intervened on and gone into treatment, and it didn't happen for a lot of different reasons. My parents didn't understand it. They didn't want to believe it. I came from a family, my grandfather was a United States Senator. There was a lot of shame around it. So I really wanted to do things to help other teens and young adults be able to change early on in life so they'd have the whole rest of their life to live a happy, healthy life with purpose and passion.
Yeah, thank you for sharing your story. I'm sure that's going to give so much courage and hope to many people who are listening to this, because one of the very important question I get from whether the addicts themselves or the family, would they ever get better? And I said, yes, look at me. I even have clients or people who just want to make appointment with me, just like, I never heard someone recovering. So I just was so curious to meet someone that they can do. Then I start sharing what they should do. Let's start with maybe treatment philosophies here. Then we can then get more in depth about the families and whatnot. My understanding or my observation when I look to the world, there's so many more opportunities in different type of rehab centers in the United States compared to other places in the world. And when I have someone who's asking me, what shall we do? Automatically my thought is like, we need to take him or her to United States because, we can pick a treatment center based on exactly what they need. What's different? What's going on in the US then it's not happening other place in the world? Because I know because you go into countries, you make intervention with families, you make these patients travel safely outside of their country into US. So you're the best person to ask this question.
I think one of the things that stands out about the United States is that we have a lot of different types of treatment modalities, and we have a lot of different treatments and treatment centers available to people. My experience overseas is that although a lot of countries do have services, they don't have as many and as differentiated types as we have here in the US. So when I first started working in the field back in the early 80s, there weren't as many options. Like I said, I ended up in a program for addicted doctors, which I wasn't. But today, if you fast forward to 2024, there's so many different options. Like we've learned that young adults and teenagers need a different type of treatment than adults. We know that older adults come in with different medical needs. We know that some teenagers do better in sort of an outdoor wilderness type program. Others have got co-occurring issues like eating disorders, severe trauma. So we have a vast array of really great facilities where you can look at what specializations are needed. Today we see a lot of mental health issues as well, a lot of drug-induced psychosis. So it's important that a person be able to go to a program where they can concurrently treat everything. Back in the 80s, we just didn't know how to do it. So, for example, if a woman went into treatment and she had alcoholism and bulimia, the philosophy was to treat the alcoholism. Once that was done, go treat the bulimia. But what would happen is a woman would be in treatment, for example, getting better from the alcoholism, but the eating disorder would start raging. So what we now know is that we have to, when people have more than one issue, and often it's multiple issues together, we need to be able to treat them all at the same time. So I feel like we've done a good job over here of really bringing in specializations and specialty programs to help address everything, not just for the client, but also for their family systems.
Thank you for sharing that. Our dear friend, you and I, Dr. Susan Blank, we often speak with her. I try to share with people here that 1 month is just this new era insurance company forced, shortened treatment modalities. And after, obviously there were these movies and stuff. So people think that when you go to a rehab, it's going to be for a month. And that's probably the hardest thing for me, for you and anyone who works in the field, that to convince someone, actually, no, 1 month is not enough, because they have this 28-day thing. Can you please explain why long-term treatment in most cases is important, and what happened, what happened along the way that it suddenly changed into the shorter thing and now we're stuck with it?
That's a great question. In the United States, the way it began was that people in the military would only be able to have a month off without losing their rank or, having consequences. So that's where the magic 28-day number came from, is that people in the military would get 30 days, 2 days of travel, one on each end, and 28 days in between. There was nothing scientific about it. In the 80s, when I was working in the treatment world, working in hospitals, it was the era of crack and cocaine, a lot of stimulant use. I mean, we've always had opiate use too, but one of the things we noticed was that people would come in for 28 days and then they'd be on this pink cloud. Oh, I'm great. I know what I'm going to do. Everything's going to be all right. They'd leave, and then we'd see them back in treatment 6 months later because they would relapse, within a week to two of leaving. So a lot of the narrative back then was, oh, treatment must not work. Well, that wasn't correct. What we came to find out was that it was not that treatment didn't work. It was that we weren't having people stay in treatment long enough. When you're using, you're telling your brain, go up, go down, go sideways. There's a lot of incoming, your dopamine system, everything's all out of control, all out of whack. And so once you go through detox, it takes time for your brain to begin to heal. So if you don't have enough time, part of what happens when your brain is trying to re-regulate is that you get moody, you get confused, you may have memory issues, you may have irritability. So people can go from being euphoric on a pink cloud to crashing and feeling like everything's awful. And so what we began to realize is that somewhere around 6 weeks after the last use, people were really having these terrible crashes right when we'd send them home. So they would pick up. The idea of, a certain amount of time to help someone, it's the only place in medicine where we do that. And I do think it's just incorrect. Like if someone comes in for cancer treatments, we begin the therapy, we begin the treatments, and then eventually we take a look at whether or not it's working or not. And then we say, okay, we've had 7 treatments, we've made a little progress, we need to do 8 more. But, we don't just say 6 treatments and that's it. So the important thing with substance use disorder, too, is to really listen to the professionals and let them say, are you making progress? Are things getting better? How much longer do you need? So that you can pace it, because everyone's individual and everyone has a different recovery rate. But overall, we do know that longer is better. And longer doesn't mean you stay in a hospital for 28 days. Like if someone goes into a critical care unit, that, you never go from critical care where you're on life support to the parking lot of the hospital. Like that's where people die. And so it's the same thing. Like when someone goes in for 28 days, that's like being in the critical care unit. What we need to do is graduate down the care so that they go from being, in the hospital to having maybe more outpatient services. So you want to continue to keep them engaged as they begin to take over parts of their lives again, so that you can integrate them back into their lives, into their families, into society, into their careers.
All right. Yeah, I know that's the treatment. So what you're suggesting, actually, it's not to make a decision from day one. Hey, it's going to be 1 month, 2 months, 3 months, 5 months. It's like along the way, let's say 5 weeks in, say like, you know what, it's better for you to stay inpatient for another 3 weeks.
Right.
Or, you know what, you're done for an inpatient setup. Now you can start your life at a halfway house, but you cannot go home. The different cares on different times based on clinical meetings. And
really just looking at the progress. Are we having improvement? Do we need more? Is there something missing here?
Heather, what I saw is, and now we're getting slowly more into your speciality. Obviously, there are so many great therapists out there who are helping clients. I see a huge resistance, even though the family wants their loved one to go into treatment. They are like, I'm fed up with that person, whatever their reason is. But then when it's time to take action, suddenly they don't have money. Or my husband needs to be at home because my son is 6 years old, therefore he cannot be without the father. Or families for their young adults, saying like, you know what, he's able to actually just drink. So many excuses come up, and that's really your forte to explain us what's happening there, and why this is an obstacle that we professional need to pass while already trying to convince the client. Now there's the whole family that you need to convince.
There are a lot of different factors that I think influence families and make it difficult for them to sort of see the reality. The first is that most families don't want to believe that it's their loved one. Like, not my kid, it can't be my husband, it can't be my grandmother. And part of this is because we haven't done a good job of explaining what substance use disorder looks like. People have this image in their mind of a person, in the gutter drinking or shooting up heroin in a back alley, which is only about 7% of the addicted population. So if people don't know what it looks like and they don't understand, it makes it really difficult for them to say, my loved one has this problem and we need to do something different. People also get really scared. They get scared that parents get scared that if, they admit that their child is got an issue or abusing substances, it might make them be a bad parent, and we all as parents have made mistakes along the way. So they're all things we could have done better. But sometimes that tends to get in the way of people saying, okay, my child really does need this help. And, often people have their own complicated relationships with substances or with food or with depression. So, I had a client one time who the father had terrible OCD in college, but he'd been able to work through it. Well, his son was at college and had paralyzing OCD, couldn't get to class, was failing out of school. And dad had a hard time understanding why he couldn't just get through it like he had, but he needed help. So it's hard. Parents come around and families come in and do things that all of us do as humans with loving hearts. The problem is that when we come in and do things, to take people's pain away because we don't like to see our loved ones suffer, when you have mental health issues or substance use disorder, it backfires. So if someone has cancer, we all come in and we say, let me help. I'm going to water the plants. You pay the bills. You walk the dog. Uncle Joe, you go to the hospital, you get your treatments, you get better. And as he gets better, he takes back all of his responsibilities. He begins to pay his own bills, walk his own dog, take care of himself, and he's grateful. And that's what families do. When you have substance use disorder or mental health issues, part of what happens is when you come in and pay the bills or take care of the family or watch the children or call into work and make excuses, the person doesn't learn from it. That's the definition of addiction. Negative consequences happen and they don't learn, they don't change. So it actually is what we call enabling. But I don't love that word because I think we've beaten our families up with it by saying you're an enabler, and parents will come in my office with their head in their hands saying, I'm the worst parent ever, I'm an enabler, because somehow we've made that turn into I want my child to die, which is not true. It's just that parents don't have the right skills, and we have to ask people to really step outside of their comfort zone to do things that support health, don't contribute to demise.
I took a note over here I was going to talk about the enabling or codependency.
Yes.
And you just jump into that, which is great. If it is like couples,
Right.
I also see a pattern of they want so bad their husband to heal.
Mm-hmm.
But then the husband is like really putting the effort in, like he's going to the AA, to the rehab, if there's no rehab, being engaged. Then suddenly I start seeing the wife acting out in a way that, not really helpful to the situation.
Right.
As a therapist, please explain why is that happening?
So I think there's a myth that the one person in the family who is struggling, the alcoholic or the person with a drug addiction or an eating disorder, the myth is sort of that if they go away and get better, everything will be okay.
Mhm.
And they're going and getting better is a big step. But the whole entire family system has to change. What ends up happening is people and family systems end up interacting in a way that becomes what we call dysfunctional. So if that's happening, it's like if you have family members like the fingers on my hands and they're all crammed together, you know, it's familiar, it's uncomfortable, and that's sort of what it's like living in a family with addiction. So to
Mhm.
really begin to heal, you literally have to deconstruct the way in which you connect to be able to come back and connect in a healthier way. And so often that's scary for people because the known may not be healthy, it may not be enjoyable, it may be painful, but the unknown is sometimes more terrifying. So that's part of why we talk about healing needing to happen for the entire family, that everyone needs to go and do their own work. And again, it's not that the person who's addicted is making everyone feel terrible. It's that there's a bigger element. There's substance use, there's trauma, there's sudden grief and loss, there's mental health issues that's affecting the person who's most in crisis now, but it often affects everyone else in the family system too. So sometimes we'll come together and do family trees and look at them and see that this didn't just happen in a vacuum, that there's addiction, trauma, difficulties throughout generationally. And so it really is an opportunity to stop that family narrative and make changes so that everyone can begin to get better and have their own healing journey.
Yeah, it's almost like the addict is the scapegoat over there, because he's doing or she's doing, such a negative thing that everybody's focusing to that person's problems and shortcomings and whatnot. And then the other one, the rest feels like, oh, I'm great, I'm okay, I don't have any problem.
Right,
He or she's the problem.
right.
Then when that person is healing, if this part is not doing some work on themselves,
Mhm.
it's not comfortable, and they're almost, it hurts me even when I say that word, but sabotaging the other person's
Yes,
well-being, because then their problem surface, whether they cannot handle their own problem or other people start seeing, oh, okay, that person needs some sort of a treatment, whether mental health or addiction as well.
absolutely. That's so correct. Yes, it's an opportunity for everyone to make changes in how they're living their lives. And so
Hmm.
we get caught up in these patterns that are rigid, make it difficult to connect with others, whether you're using and abusing substances or you're living with someone who's using and abusing substances. So we want the focus to not be the substance. We want the focus to be how do we, connect with each other in healthy ways so that our relationships are flourishing because we all, recovery doesn't happen by yourself. It happens in community, it happens in connection with others. And so part of it is learning how to connect, how to attach, how to be able to really be honest with people and say, I need help, or say, I appreciate you, or say, I'm feeling sad today, and really be honest with yourself and others.
It's super, super important. Tell me a little bit about what intervention is and what's the proper intervention style. You have a company for that. You help people around the world. You also have a system that not only you have a whole team of people.
My first intervention in 1986, I took a training and I didn't really like doing it. It went against a lot of what I believed in, more of an ambush quality to it. I was trained that you had to sit down and tell everybody, tell the person everything they'd ever done wrong. And as a woman in recovery myself, I thought, gosh, that's horrible. Like I already knew everything I'd done wrong. I already felt horrible about myself. I didn't need somebody else to come in and make me feel even worse. So around the turn of the millennium, I became exposed to different ways of doing intervention that really fit my style. I had a lot of experience in working with individuals with trauma, And the last thing I ever want to do is come in and re-traumatize people. So I think I took a lot of that work into doing interventions. In fact, I don't even like the term intervention, because it sounds like we're going to tie somebody up and drag them away, or like it's a big confrontation, which it's not. I prefer to call it a family meeting. And so with an intervention or a family meeting, it's a very structured event. We come together. I work with the family, and my team works with the family prior to help them begin to understand the dynamics, have some education about substance use disorder, to help them realize that their loved one is not bad or doing things on purpose, but to get a better, concept of the brain chemistry and what's off, and how, the symptoms of substance use disorder look horrible. It's lying, it's cheating, it's stealing, it's making promises that you don't keep, it's mood swings, anger. It's awful. It's awful being on the other side of substance use disorder. So to help people understand that in this moment, when we get together and have the family meeting, we want to sit down with a person and say, we love you, you're valuable, you're important to us, you're an important family member, and here are the things you can't argue with us about. I'm hurt. My heart is breaking. It pains me to watch you like this. You're not the person you could be. I know you'd never want to hurt your children, but your behaviors are hurting your children. We need you to get help. We can't keep living like this. So it's partially appealing to a person, to that part of them that doesn't want to live like this either, and trying to present them with that piece of reality that you may think everything's okay, but your loved ones, are sitting here telling you it isn't. And also saying there's a way to get help. And we've got that all set up for you. Because people with substance use disorder will often say and acknowledge they need help, but they aren't able to execute it. They aren't able to get where they need to get, or stop, or do what they need to do. It's also important for families to come in and say, we can't keep living like this anymore. So if you're telling us you're going to continue on this path, using drugs, taking money, making promises, here's what we need to do to protect ourselves from the hurt. We can't do this anymore. And so it's empowering the families to take better care of themselves, empowering a person to go and get that help. And there are often, people think of intervention as where you have to come in and surprise someone and don't tell them you're coming. And 90% of the time, that's actually the wrong way to do it, because people who abuse substances, there's a high rate of them having been traumatized. And if you've had trauma in your life, be it a natural disaster, a war, sexual molestation, being mugged, violence, surprise is horrible. Surprise is uncle coming in the room in the middle of the night. Surprise is a bomb going off in a car next to you that you didn't know was going to go off. Surprise is terrible. So trauma survivors don't like surprises. So why would we start out someone's healing by coming in and surprising them? So it's more having a family get prepared, but then saying to their loved one, we need to sit down with a professional and have a family meeting. We need to talk. This is really serious. We're in a lot of pain. We all need help, and we want to talk about what that might look like.
Yeah, and then you have a whole team that you guys follow up with the family, correct?
Yes.
It's like not just like convincing the client. The work starts actually after.
That's right. The work starts before, during, and after. And one of the things I feel good about at this point in my career, having done this for 40 years, is I do have a team. So when the person goes into treatment, the family still needs a lot of support. So when we do interventions, we insist that people work with us for 6 months, so that as their loved one is getting better, the family can make changes and they can begin to get better too. Because all the research shows doing that has the best success rate for families coming back and reuniting in a way that's healthy, where they're able to appreciate each other, love, respect, like all of their family values can begin to flourish, and they live happier, healthier lives together.
Yeah, oftentimes you help also the client to be able to be transported from
Yes.
their hometown to wherever they go. Just today, I was talking to someone, the ex wife, and she was like, well, he's not at a situation that he can travel. People are really very fearful of what to do because they see their loved one falling down drunk.
Yes. Yes.
How do you guys do that? Because most of the time, people may even need, I don't know, like you explain actually, because there's so many different cases that you face. So give a couple of cases that can
Sure.
explain how difficult, how dangerous, and without the help of someone may create really a disaster.
Yes. So a lot of people, when they're getting ready to go to treatment, experience an enormous amount of anxiety. And if you have a substance use disorder and you're anxious, and anxiety is fear, then one of the ways you calm the fear is to use your substances. So travel anxiety, getting somewhere, the inability to stop using can all make travel very dangerous. There was a case about 20 years ago where a woman was traveling by herself in the United States to go to treatment in Arizona. And she got so intoxicated on the airplane when she landed in Phoenix, she was detained by the police, and they put her in a cell, and she actually ended up dying because they had cuffed her and she hung herself. She was so impaired. And that's an example of someone, who shouldn't have tried to fly to treatment by themselves, and it's an extreme example, but it can be really dangerous. So having someone there who's been trained to help, first off, just handle the logistics, deal with the airport, with the security, checking the bags, all of that, but can also help keep someone calm and be aware of withdrawal symptoms. Alcohol withdrawal can be deadly. Withdrawal from benzodiazepines can be deadly. So some people aren't even safe to travel. So it's important to really have someone come in and medically evaluate that. Some people need to have some detoxification before they can get on an airplane. Others are safe to travel, but you want to keep them comfortable and keep things moving. There have even been times where we've helped transport people because you can have a lot of different medical issues along with substance abuse, like liver failure. People fall, they have head injuries, pancreatitis. So we've often used air ambulances even to help get people to get to the care that they need, because staying at home and doing nothing is only going to make it worse. But you want to make sure they're able to get somewhere safely and with people who are able to help take care of them on the way there.
That's a very important and very crucial service, in my opinion. So recently, they changed the description of criteria. Instead of saying addiction, nowadays they're calling it substance use disorder and their levels. How do you describe them? And I'm going to attach another question to that, because my fear for Turkey, because we do not have proper addiction treatment centers, what I would call a rehab center. Actually, it doesn't matter, the words can be different, but the treatment should be the same. But in Turkey, due to regulations, they have what they call a treatment, which is very focused to a detox and a stabilization. It is, people stay maybe 2 weeks, if they're lucky, a month. And what I see is often, sometimes few months later, but then after, if they get in and experience that couple of times, let's say within the 3 years period, then the frequency of start using it much faster, and it becomes now at the revolving door, in and out, in and out. And I kind of find that very dangerous. I'm curious about your thoughts.
No, I completely agree. I mean, I think that's part of what we talked about earlier. Person going in for 28 days or 2 weeks and then coming out and not having a good, solid aftercare plan. And there's no other illness where we would do that. If someone goes in for diabetes, then they have an aftercare plan. Here's your insulin. We're going to check your blood sugar every day. We're going to see the doctor in a week. We're going to follow up. And so, that continuing care is the only way to have sustainable recovery. And when we talk about recovery, back to sort of your first question, I've worked in the field for about 40 years, and I've seen a lot of different changes. Initially, we talked about alcoholics and addicts. Then they changed it to saying chemically dependent. And so there's been an attempt along the decades to really destigmatize and substance use disorder be seen more as a medical issue. And so the changing of the terminology, I guess people felt that calling someone an addict or an alcoholic felt degrading. So substance use disorder put it more into the mental health realm, and that it was less critical, came with less stigma. So that's really been a big piece of the change. And so they've encouraged all of us to really look at how we word things. I'm so used to it because I've been in recovery for so long. I'm so used to saying, my name's Heather, I'm an alcoholic and an addict. But, if I were to be, with the new times, I'd say, my name's Heather and I'm a person in long term recovery from substance use disorder. It's a mouthful. It all really says the same thing. But, it's a lifelong illness. It's an illness that generally starts young. It's a young people's illness. Most people will tell you the first time they began abusing substances or using substances was in their teens. For some, they get in trouble early adolescence. Some get in trouble during that sort of launching period point of their life, 18, 19, 20, when you're supposed to kind of go out and become an adult. Others don't get in trouble until they're in their late 30s. A lot of women we see begin to develop symptoms and their drinking or drug use changes when they begin to hit menopause. And then there's a whole set of issues that come up when people get older and hit retirement and they've been using substances for decades, and all of a sudden the body says, I can't take it anymore. So the point is that no matter when a person gets into crisis, generally it starts younger. We know with any illness, the earlier we can intervene, the better. With breast cancer, for example, before we had early intervention and screening tools, women died all the time from it. Now we have, early intervention, mammograms, screening, and so women are able to catch it early. We've saved lots of lives. We can do the exact same thing with substance use disorder, and we need to. Substance use disorder kills more people than a lot of other illnesses. In the United States, more people die from substance use disorder than they do automobile accidents, gun accidents. We lose about close to 300 people a day from a fentanyl overdose, from overdoses. It's outrageous. It's like if you had a airplane crash every day of people dying, we'd be completely in panic mode. And we don't do that around substance use disorder, maybe because of the stigma, maybe because of our ideologies that everything, it's just such a part of our culture. But, I've often said, like in our high schools and our elementary schools, we have fire drills, we have tornado drills, we have bombing drills, we have active shooter drills. But we really need to also have addiction drills because it's far more likely to kill our children than tornadoes or fires or some of the others.
I agree with you. But how would, I don't want to say just families for their young ones, but how would people around us pay attention to in order to catch the progression of the disease early on?
It begins at a grassroots level. It begins with those of us professionals getting out into our communities and talking about what is addiction, what is substance use disorder, what does it look like, what are the signs, what are the symptoms, educating people about it so that families are able to have these discussions at home at their dinner table and to understand if you have friends who are using and they're getting in trouble or they're getting in trouble at school or they're buying drugs off the street that could have poison, fentanyl in them, those kinds of things, that it's serious. It's not disgraceful to ask for help and that there's a lot of help available. So I think that it's, our responsibility as professionals to educate the communities, to educate our places of worship, to educate the schools at a young age. And, in doing that, begin to help people understand that there's help out there And then we also have to provide it, as countries. We have to come in and begin to have more resources to help people struggling with substance use disorder. But the things you want to look out for too are like changes in behavior, changes in attitude. Things that used to be important in a person's life aren't anymore. They continue to have negative consequences. They get behind the wheel of a car, they have accidents, they say things they wouldn't normally say, they do things that are outside of their moral compass when they're drunk or high that they wouldn't do when they were sober or not using chemicals. And when you begin to see these things, we want to intervene early. By the time a person becomes non functional, we're usually looking at late stage addiction. And by then, it's often too late because you've got serious organ damage. So, if we can come in and help people early on, then we can save a lot of lives and have some wonderful, amazing, bright people out there in recovery being able to help others like you and like me.
When you say organ damage, not only like you're talking about the liver or the kidney, I think also the brain gets a lot of damage.
Yes.
I would love you to talk about that a little bit because I try to say to people, you know what? It's not about like how many drinks they drink or how many, joint they smoke. It's about the thinking and the behavior, and that all happens because of the brain.
Right.
I would love to hear it from you as well.
Absolutely. When a person, particularly a young person, is using drugs and alcohol, you're pouring that on top of a brain that's immature and undeveloped. We know the brain doesn't mature until 25. So if you're drinking or smoking marijuana or using drugs at 14, 15, 16, the brain can't even develop as it's supposed to. There's actually a process of brain growth called myelination, which is where the neurons are coated with this myelination sheath that helps the electrodes in your brain conduct better. So your brain learns how to talk to itself better and you're able to function better. And marijuana in particular comes in and stops that process from happening. So literally, you can cause brain damage and stunt your brain growth by pouring chemicals on your brain. And then when it's done for years, we see people who end up literally with part of their brains atrophying, unable to think.
Mhm.
And it often looks like dementia, but it's truly just the alcoholism. And another thing that can happen, alcohol will pull the vitamin B out of your body. And there's a whole nother syndrome called Wernicke's syndrome that looks very much like dementia, and that's from a lack of vitamin B. So there are a lot of issues that take place. When you're pouring toxins into your body every day, it affects every organ: the brain, the liver, the kidneys, the lungs, the spleen. We're seeing more and more young adults over here having liver failure. I had a client recently who has been on life support because she needs a lung transplant because of smoking crack and heroin has damaged her lungs. The drugs out there are very potent, they're deadly, and they can have serious consequences that can't be undone.
Pedro, what do you think of this conversation I often face? Like, oh, the person needs to be willing or wanting to get sober. I don't see many times an addict who wants to be suddenly, hey, I want to quit and I don't want to do any of these and I want to get better. Is it smart to wait until that they're willing to go into a treatment?
That's a very dangerous myth that a person has to want it to get better. All the research shows that a person does not have to want to go into treatment for it to be successful. In fact, most people go because of pressure from their families or for the courts or from their employers. And if you think about it, when people are using drugs and drinking, they're impaired. They're not thinking straight. So if you're not thinking straight, how can you wake up and make a good decision about your health care and your life? So that's one of the other reasons why I love interventions, is because we help get someone into treatment where their brain can begin to clear. And then a few weeks in, when they've got some good coping skills, their mind is clear, they can make a decision about what they want to do for their health for the rest of their life. But you're in no position to make that decision when you're in active addiction. In fact, the myth that you have to wait for someone to get better often means people die. So with interventions, part of what we want to do is what we call sort of raise their bottom. Because for a lot of people, if you don't, the bottom could be death.
Thank you for sharing my very important belief, because it's really, most sentence that I hear is like, oh, they need to be willing. So I'm glad that you shared this, and I'm going to ask my producer to put this sentence at the beginning of the episode, because that whole sentence drives me crazy. So Heather, thank you so much. This episode was very, very beneficial, obviously to me, but to people who are going to be listening, because we were able to touch base on many issues that people are facing. How would they find you? I'm sure that people, if they need your help, they're going to reach out to me when people need for help for addiction. But still, please share your information. So if they want to directly come to you.
One of the things I've tried to do on my website is to write a lot of different informational articles so that people can go and read, like, how do I know if my loved one needs help? Why does the family need to be involved? What is ADHD? So I welcome anyone to please go through, take a look at my website. It's www.heatherhayes.com. Hayes is Hayes. So www.heatherhayes.com. And in there's a way to reach out, email me. My phone number's on there, and we're happy to help anyone.
Thank you so much for your time.
And thank you so much for having me. I'd love to do it again sometime soon.
We will. Thank you.
Thank you.